About 15% of all couples suffer from some form of infertility, the inability to achieve a pregnancy. About 50% of this could be related to male factor infertility. There are a number of myths out there, the first being that it's primarily a female problem, which is absolutely not true. About half the time there is some sort of male factor infertility as well. There are a number of other myths as far as exposure to tub bathes and spas or tight underwear, things like that for the male patient that really are not quite true. And the evaluation for male infertility is actually a little more complex. Another myth is also that there isn't much that we can do about it, which is also totally not true. With the advance of technology, there are a number of treatment options now that we have for male factor infertility. And I think what's most important is looking for this and evaluating the male thoroughly when a couple presents for infertility workup. There are very few male infertility centers in the country, and even fewer centers that actually include a male infertility and a female infertility clinic combined into one. What we offer here is male infertility workup services in combination with female infertility workup. This allows a couple to be evaluated together. There are a number of myths out there. One of them includes the fact that male infertility may not be as important when a couple is having difficulty in achieving a pregnancy. And in fact, 50% of infertile couples have some sort of male factor infertility contributing to the problem. So what we offer here is very unique in that it's a combined approach or a multidisciplinary approach to the workup of couples who have infertility, both male factor and female factor. What is unique about our program is that I'm a male infertility specialist. I'm a urologist by profession, but I've got a specialty fellowship training in male infertility. And what we offer here is a special collaboration between the University of Florida and Fertility CARE, where I work with Dr. Mark Trollis in trying to achieve our end result with these couples in achieving a pregnancy. And we allow the workup and evaluation and treatment of male factor infertility in combination with the female infertility workup. What got me interested in male infertility was, I was a patient myself at one point, and I think when you've been on the receiving end, it changes your perspective a little bit. And most guys are pretty reluctant to come in and get a workup done, and I think it helps to break the ice a little bit in conveying that message that they're not alone. And unfortunately, even though it's a tough situation to be in, that there are a lot of solutions and that there is hope. And I think that's the most important thing, is to convey that we're really here to help the couple as a couple, both the male partner and the female partner. My background's a little bit unique. I've been dual fellowship trained in robotic surgery and microsurgical and infertility surgery. I got my training at the Cleveland Clinic in Cleveland. What this has allowed me to do is bring over or transfer some of the technology that we use, for example, in treating cancer patients, namely robotic surgery, into the infertility realm or treatment of men with infertility problems. We are one of the world's first leading institutions in performing robotic microsurgery procedures for male infertility. We now offer robotic vasectomy reversal. We're one of the world's leading centers offering this. The only center in the country right now that offers this. And I think there's one or two other centers in the world, but we really have the leading experience when it comes to this new technology. What robotic microsurgery allows the surgeon to do is to do microsurgery, for example, in a vasectomy reversal, to re-anastomose the two ends of the vas with precision that's just not capable with human hands alone. And so it takes the surgical repair or correction to a whole different level, and hopefully this will pan out in the future to result in better outcomes. So far in our preliminary results, it seems like robotic reversal provides a better early return of sperm counts compared to standard microsurgical techniques. We've taken this technology and also applied it for example, the correction of varicocele. Varicocele are when some men may have excess veins around the testicle. And the theory is that this excess collection of veins perhaps creates an environment around the testicle that's not favorable for sperm production, and therefore these men may have lower sperm counts. What we essentially do is bring up the spermatic cord and micro-dissect out these veins and ligate them. What the robot has allowed us to do is to make the incisions smaller, and hopefully will lead to quicker recovery and better outcomes for these patients in the long run. On the female infertility side, there have been tremendous advances. For example, the advent of ICSI. This is where we're actually able to take an individual sperm and put it inside an egg, essentially, to improve the fertilization rates and to overcome a number of fertility factors that we were faced with before. So overall, I think what's most important for the couples to understand is that we have a number of options to help patients achieve a pregnancy. And I think there really is quite a bit of hope that we can give these patients.